Good afternoon, North Dakota. Today, the North Dakota Department of Health confirmed 24 additional cases of the coronavirus disease, COVID-19, out of 401 tests. Today's 24 cases is the highest that we've reported since we've begun reporting on a 24-hour period. So this would be for the 24-hour period of April 14th. I know that we've spent a lot of time talking about how this is a deadly disease for people that are older with underlying health conditions, but I did want to also note that of the 3 of today's 24 additional cases were people under the age of 20. As a reminder that any age can get this. There's obviously a greater health risk and risk of mortality with age and underlying conditions, but any age can contract this. We have also want to note on that first slide, in the upper right-hand corner, 6% infection rate in terms of that's the 24 over the 401 tests. That's the 3rd day in a row that we've had greater than 5% positive. So that's at least 3 days beginning a trend that puts us well above what was our 3% or 3.1% trailing average. That's pulled that trailing average up to 3.2%. That's what you see in the lower corner. But so we're trending the last 3 days above. I would also share that I've got concerns. I said that Monday and Tuesday's data was going to be a little bit light because we knew that we had less testing happening over the Easter weekend. We've also had some mechanical issues with testing at the lab. Our lab team has been amazing. They've been doing fantastic turnaround in recent days. We had 100% of the tests that we were reporting publicly had all been collected and processed within 48 hours. So we were really performing. And again, that's also want to thank our private lab partners because we've been using some capacity earlier at Mayo, and also Sanford Sioux Falls has been processing tests as well, and those are all combined into these numbers. But at the North Dakota State Lab, where we had that issue for the first time since we've been in this, we've got a little bit of a backlog right now. Almost 400 tests are backlogged. We are sending the state plane to pick up a technician from Abbott in Michigan, and that's happening right now. They're going to be back here. That's going to help us get these back online. We had previously gone to 2 shifts a day in the state lab, and we're gearing up to do 3 shifts a day so that we can get more testing done per day at the state lab. And we know that our partners are also expanding their capacity. We want to continue to drive that up. I'm saying this because if we apply the 6% rate to the 400 tests that weren't done that could have been an additional 24 positives. We could have had a day today that was 48. If it was 3% on our trailing, hard to think it would have been below our trailing run rate. 3%, that would have been 12. So we could have had a 36 day. So this is our top day, and we're even missing some data. We've talked all along about how we might be starting to enter into a point where the curve would increase. We don't know, again, because of the light numbers of the Easter holiday, and we'll know more when we get that backlog cleared, but it is possible that our curve is starting to climb. The next slide we want to cover is 214 active cases. This highlights the fact that we've had 142 people recover, which is fantastic. We do have 13 people that are hospitalized, again indicating that we have lots of hospital capacity available, which is why we went through all these exercises. So that part is working, and we thank everyone for their role in practicing the North Dakota Smart Guidance, which has helped us create this capacity. But I do want to also share that for those that think this is only something to worry about if you're older, 2 of the cases of people that are hospitalized are under the age 30, or one under age 30 and one under age 20. And so that is also, again, something we want to make sure the public is aware of. And sadly, of course, we've had 9 deaths, but no more deaths since over the last 2 days, which is good news. On the case trends chart, which we show every day, updated for all of this, again shows we continue to climb in number of active cases, active cases above 200 for the first time, and we like to see that recovery growing, but in days like today, the numbers of new active cases exceeded those recovered, so the number is still growing. When we take a look at statewide testing, again, we want to share this in terms of tests completed per 1,000 people. With the testing that we did targeted in Slope County, that got us to 170 out of 1,000, which is interesting math, because there's not 1,000 people that live in Slope County, but on the way that all works out okay. But I was just going to say the world leader of this is Iceland, a country with only about 330,000 people. They've tested about 10% of their population, and so we were probably, if we have in a rate of 170 per Slope County, we were approaching Iceland's quality in Slope County, so that's a good thing. If we could do that over the whole state, that would be great. But I think you can see across the state, again, with this surge testing we did up in Montreal County, again, that was held in Montreal, but we did have people from 13 counties and 5 states participate, but that's what drove those numbers up. The numbers for Bowman, Hettinger, and County also went up because of the testing that was happening in Gladstone, North Dakota, and Stark County and Slope. So where we've been able to do this and gain more information, that's been positive, and we've continued to have our discussions with the White House. This morning we had a very good call with Dr. Birx again this morning about the proposal that we had submitted a couple weeks ago about additional testing in North Dakota, and we were encouraged as North Dakota we've got our hand up, and we are under consideration for being one of the states that could be involved in more surveillance testing. We hope that the good work we've done in the last couple weeks will help move us into that group that's selected for that. On the next slide, again, when we take on the positive rates, we've got some of the counties in western North Dakota that have got a higher percentage of positives per number of tests taken. But again, where we've got the most number of actual cases in our most populous county, Cass County, that 5.5% number, something we're watching because that continues to be above the trend line of 3.2, so we have to pay attention to that. And as I mentioned yesterday, again, there was 40 cases through yesterday in Clay County, and that's all part of the same metro area, so it's something we have to pay attention to. Next topic is related to our executive orders and business restrictions. Our mission since this pandemic began has been to protect our most vulnerable citizens, the elderly and those with underlying health conditions. And we've identified earlier that represents over 20% of the population of North Dakota. To flatten the curve, to do that, the reason we were doing all these exercises, if you will, to slow the rate of this highly contagious virus and highly deadly virus, was to make sure that we had adequate hospital capacity. And I think that you saw yesterday with the hospital surge plan and with the effective work that North Dakota citizens have done, we've achieved that. Since this crisis began, we've issued 27 executive orders and 7 amendments to those, so 34 in total. 26 of those related to reducing red tape, so the majority was for that purpose. There's another 17, because sometimes there was multiple purposes within that, executive orders related to implementing public safety measures. And we had one executive order, 2020-06 was the only executive order that related to business closures. That's been amended twice. So we want to talk about 2020-06 today. Throughout this, we've stressed the importance of individual responsibility and the success that we've seen in North Dakota in terms of the low number of absolute cases, the low percentage, the 3.2% positive cases is the second lowest in the nation, behind Hawaii still. That is, again, that success depends as much on what individuals and organizations, whether you're an employer or a faith-based organization, what individuals with personal responsibility, with organizations, with their leadership, our success has much to do or more to do with those organizations and all of you as individuals than it has to do with what government says. So we say if North Dakota's been successful, it's because of all of you, so thank you. The actions, again, uncovered opportunities to reduce red tape and regulations to ensure that we could be more efficient and effective in our response to COVID-19. But that Executive Order 2026 was different, because on March 19th, we announced that health clubs and athletic facilities and theaters, including movie theaters, music, entertainment venues, concerts, and recreational facilities, think of that as a swimming pool at a university or your local YMCA, those were all ordered to be closed. And then we also closed bars and restaurants not from a close, but we restricted them to conducting their business only to off-sale, takeout and delivery, curbside or drive-through, and restricted the ability to have patrons, on premises. 8 days later, in an effort to protect all the personal care workers in the state who were getting a lot of close contact with individuals, we closed the personal care businesses, which include cosmetologists, salons, barbershops, tattoo parlors, tanning facilities, and massage therapist businesses. And so we've done both of those two things. And throughout all of this, and when we did those closures, we announced that we were going to close them through April 20th, but we promised that today we would announce our decision today about what we would do, whether extend or not on April 20th. And through all of this, we've heard people say, from both sides, we've heard people say that we haven't gone far enough with the restrictions. That's been allowed and often repeated phrase, that we haven't done enough. We've also heard many others saying that we've gone too far and it's time to, reopen our business and restart our economy. And I think those that I share the sentiment that many have about let's get open again. And I'm sure they're reacting to the fact that our numbers have been low. And our numbers have been low because of the actions that we've taken. If we had not restricted the contact, we know, whether it's in neighboring states or across the world, we know that this is a highly contagious virus that can spread quickly if you give it a chance. And again, North Dakota has taken the steps to reduce the number of transmissible contact moments by the physical distancing and all the North Dakota smart actions. The voices on both sides of you've gone too far and it's time to reopen, those are often amplified by social media, but I want to assure the people in our state, and particularly those 20% that might be people that are in compromised situations because of underlying health conditions, or if you're living in a congregate home somewhere in our state, if you're working in healthcare and you're exposed to all this, I want to make sure everybody knows that while we're taking all of that as inputs, what the voices from both sides of this, we're making our decisions as we said we would at the beginning, based on data. We're taking a measured approach. We're trying to be very targeted with the overarching goal of two things: not only saving lives, but also saving livelihoods. We're in the business not of either or. When we're leading a state like this, we're in the business of and we don't have the luxury of the or. So we have to figure out how to do two things at the same time, and that's going to involve all of us figuring out new ways to operate in a world where we have a pandemic for which presently there is no cure. Many businesses I want to compliment that have closed voluntarily, because a dentist office, for example, the North Dakota Dental Association, in an effort to protect their patients and their staff, more or less closed across the whole state. They're working on plans on how they might reopen and do that under new standard operating procedures that would protect their patients and customers as well as their staff. In talking with the healthcare, again, other states had made government orders to mandate that people stopped doing elective surgeries. I want to remind people that we did not do that here. And given the capacity we have in our state for ability at our healthcare facilities, the number of beds that are available, and the amount of PPE that we've been able to build up, again, I would say, talk to your providers about whether or not you might be eligible to proceed with necessary health procedures that perhaps should not be deferred, because we do at this moment have the capacity. Even one of our state's largest manufacturers closed, and they did that in part because of global supply chain interruptions, and also because they wanted to make sure that they were in a position to protect their employees. We respect all of these businesses that have done this, made these decisions, and of course, we've already complimented all of our faith-based organizations who, without mandates, chose to find ways to connect with their parishioners and their congregations, and to do that remotely and while protecting the health and the welfare of their congregations. So again, in North Dakota, the tremendous progress we've seen, the compliance we've seen with the North Dakota SMART guidelines has been largely due to the great individual and collective responsibility of churches and organizations. But again, agriculture was deemed essential, so that there was never any closures on ag or ag businesses. Energy business was essential, no closures on that. Healthcare not closed. And so we are fortunate, as many states wrestle with how to reopen, we're pleased in North Dakota to understand that a big portion of our economy never closed. It just kept running along in a North Dakota SMART way. But for all along, our reasons for business closures, and including the school decisions that we made very early to shift to distance learning. We put in restrictions for public safety and protect our elderly, on restrictions on nursing home visitations, and all of the strong recommendations to follow the CDC guidelines. That has been to make sure we don't overwhelm our hospitals as they ramp up. This has bought us time to deliver the great plan that we produced yesterday. It's bought us time to build up supplies of ventilators and PPE. And so as I said, we're in great shape that way. And you saw the plan yesterday that would allow us to nearly triple our bed capacity. The good news is that we're on the right track, and we don't see that we're going to need that. We're on the right track because of the actions we've taken collectively. But I want to say again at this time, we are not far enough down that track to safely lift business closures at this time. As you saw from the numbers today, the numbers continue to climb, and the peak for North Dakota is likely still ahead. A lot of national attention appropriately has been placed at one incident in South Dakota. Smithfield Foods is an incident which will probably become labeled, and I want to say, we're doing everything we can, but our Smithfield Foods may still be in front of us. This meat packing plant in Sioux Falls has more than 500 employees who've tested positive, and over 100 cases of non-employees who became infected through contact with the employee. This puts it among the largest outbreak clusters in our country. this is a critical infrastructure business, an important part of our nation's food chain. And so it's again, there's some mistaken thought that this could have been prevented had there been a shelter-in-place order in South Dakota. But this plant was in any state in our nation. None of the shelter-in-place, none of the stay-at-home orders from any of the states had any orders to shut down elements that were part of maintaining our nation's food supply. And so this is the kind of outbreak that can happen in any state at any time, and it can happen in essential or non-essential businesses, because the virus can't tell the difference between that. The virus moves among people regardless of your occupation, and so we have to just remember that. This one's close to home, so we wanted to highlight that. And I would say that again, even states that are on the downside of their curves, because some states, as we've talked about, have curves that started earlier than ours, and they were steeper than ours because they perhaps didn't take action as quickly as North Dakota did. Those curves, even when they're on the way down, there's nothing that we've seen from monitoring the other 50 states that says that anyone was going to be reopening as quickly as Monday. And again, our numbers, which we're focusing on, don't suggest that we should be the first state in the country to reopen, given the numbers that we're seeing today and perhaps we'll see in the coming days. Therefore, I am extending the guidelines that were under the 2020-06 executive order. I signed that just before coming down here today, that we're extending those business closures for 10 days. That takes us through April 30th. We're doing that to protect the health and safety of business owners, their employees, and their customers. This approach we've discussed with our legislative leaders. Either personally or my team has had discussion with with the legislative leaders of both houses and both parties today, and they support this direction. We've got mayors across the state that support this. Our healthcare systems have been in support. And last night we had a call with 7 Midwestern governors, all of whom were those that did not issue the formal stay-at-home orders, but have taken swift action to slow the spread. And none of those were planning on doing any openings before the first. And why I say this is important: independently and act smartly in North Dakota using our own data, but this is also a situation where there's been a lot of concerns, whether it's people calling us about worrying about out-of-state travelers, or out-of-state fishermen that are coming in, or people coming in because of the work that they might do in the state in the oil field coming from out of state. Those concerns are all legitimate when we're trying to slow the spread. And if you were the first state to quote fully reopen, surrounded by states that were not in those closure situations, we could easily see a resurgence. So while we will act independently, there is certainly some coordination on a regional effort, and we've had conversations with all of our neighbors about that, and with this group last night about how we can smartly reopen on a regional to not create risks for each other. The guidelines, again, that come from the federal government around the coronavirus guidelines for America, those guidelines are pretty straightforward, and we've incorporated those into North Dakota Smart, and I can just summarize those again. But key things that everybody's doing that we should keep doing: if you feel sick, stay home. If your children are sick, keep them at home. If someone in your household is tested positive, we've got the orders out there right now that we're asking those that are, if you're living a household member with someone who's tested positive, that you also remain quarantined. If you are an older person or someone with serious underlying health condition, you should stay home and stay away from other folks. Avoid social gatherings, either organizing them or attending them with more than 10 people. You can support restaurants by using drive-through pickup or delivery. Avoid discretionary travel, shopping trips, or social visits. Observe and follow the important restrictions on visitation at nursing homes and long-term care facilities that we have implemented. And of course, practice good hand hygiene. This is key to stopping community spread. Washing your hands, avoid touching your face, sneeze or cough into a tissue, disinfect frequently used items and surfaces, and wear a mask as appropriate. A lot of you are working from home. That's fantastic. That's slowing down these number of transmissible moments. And workers that are in critical infrastructure industries, healthcare, food supply, energy and agriculture, you've got a responsibility as essential worker to maintain the work that you're doing. But you and your employers should make sure that, again, that you're taking all the special precautions to protect those workers' health at work. Our plan is to, going forward from here, so we've announced that we're extending that particular order by 10 days, but we are shifting our energies from yesterday's report on the hospital capacity and all the work we've done to make sure that we've got the hospital capacity. The key to hospital capacity was that's the way you save lives. Delivering care at the highest level with the right equipment, with the right people is the way to save lives. Now that we're confident that under even our worst case scenarios that we have enough capacity, we are amplifying and our energies about reopening North Dakota, what we might call a smart restart. This is a multi-stage approach to resuming economic activity in North Dakota, and it balances the need to safeguard lives and our livelihoods. As we've talked about, this is not lives versus the economy. This is about lives and lives, because when we have a strong and healthy economy, then we've got strong and healthy families, and we have, with people that have strong economic position, their health is always better. They've got access to be able to afford the things they need, whether it's food, whether it's nutrition, whether it's education, it's all of those things, and that's how we move ahead together. Our approach to North Dakota must take into consideration our own unique circumstances, our own unique geography, and our unique economy and our unique capability as individuals. And so as we think about that, we'll plan all of that into that. But there are certain things that we need to have when we do this, and we've got some of these things up on this plan right here. Because number one, widespread testing, we've talked about that. If we're going to get everybody back to work the way we need to get everybody back to work, we have to ramp up our testing capacity. When you do the testing and you find a positive, we've got to be able to deliver really robust contact tracing to follow that up. We got targeted effective containment, again, which is instead of asking the whole state to stay home, those people that are either positive or living with positive or been exposed to positive, those people are the ones that should self-isolate and stay quarantined. And that's, we're talking in that case, hundreds or 1,000 people as opposed to the entire state. That will be effective. We need to make sure that our protections for the most vulnerable actually get better. We're doing a good job we've been able to keep any kind of widespread crisis out of a nursing and long-term care facility so far. That remains one of the biggest risks around the so-called reopening, if you will, because of that potential infection. Sufficient healthcare capacity, we think we've got that one nailed. Ample PP availability, that one we're making great progress, and that'll continue to improve in the weeks ahead. New standard operating procedures for businesses. This is something where we're going to be initiating work with business associations and with organizations to make sure that we can come up with safe rules on how to operate your business with COVID adequate going forward. And lastly, and importantly, we need to be talking about be prepared for potential future spikes. Another way to think about this is under what criteria would we actually have to start closing things down again? Now that's a hard thought for people to think about, that we might, if we, hey, we're, have the potential to be opening up, and now they're already talking about closing down. Well, a little history always helps, because science would tell us when you've got a pandemic, this highly contagious virus, this kind of a deadly virus that's not a one-and-done virus season. In the 1918 influenza pandemic, which has also been called the Spanish flu, first wave hit in March. The second wave came that fall, far more deadly. 195,000 Americans died in the month of October 1918 itself, out of a total of 675,000 U.S. deaths. People thought it was over. That wave passed in December, but a third wave, which started in Australia, made its way back around the world, started in Australia in 1919, worked its way back to the U.S. So again, we have over the next 2 weeks between now and April 30th. We are not slowing down the work that we're doing. State government continues to function at virtually all levels, even though people are doing it remotely. But the teams across the state that are assigned and working as part of our unified command, and all the folks that are working to get our state rolling again are working around the clock on increasing testing capacity, dramatically expanding our contact tracing and the infrastructure that supports that, whether that's the Care 19 app that we've asked people to download, or the work that we're doing to make sure that we've got the right kind of database systems to support contact tracing to make it efficient. We want to expand our ability to prevent and rapidly respond to outbreaks at long-term care facilities to protect our most vulnerable, and we also want to be ready to roll when we go into workplaces. I think it was announced today Mayor of Grand Forks had an announcement today at the related to the LM plant where they make wind blades in Grand Forks. We had an outbreak there of 8 people that all tested positive. And again, got that news yesterday. Team in North Dakota was on phone with them last night. LM is owned by General Electric. We had calls with General Electric this morning at 8 a.m. Local public health officials, plant managers, City of Grand Forks. A plan's been put in place. The plant is going to be closed for a few days, and the plant's going to be disinfected. We're doing robust contact tracing of all the individuals that those who tested positive may have come in contact with. We're going to have a mobile testing team up there tomorrow to do that work and identify again. So great that we've done the work that we've done in Slope County and Gladstone and MHA, because that's the kind of capability we can bring, whether it's to a nursing facility or to a manufacturing plant. And this is the way we have an opportunity to quickly shut down a outbreak so it doesn't get into the hundreds like we've seen in other locations. So we will continue to work to expand that capability, because we have to have the ability to perhaps do more than one a day, and we might have to be able to respond in less than 24 hours versus in 48 hours. So the team's doing amazing work, but we got to get even better and stronger. In terms of what we set up back in March when we got into this, right away we knew 2 things. We knew that we were fighting a health crisis, and we were fighting a economic crisis. So we had a group called the Economic Resiliency Team or Task Force that got going right at the very beginning. Almost at the very time we had our first case, we started talking about this. Dozens of calls and meetings have been held with business, industry, and other stakeholders. And this team led by the North Dakota Department of Commerce, and our office will be leading the efforts on what we're calling North Dakota Smart Restart. And over the next few days, Commerce will be working directly with associations that represent the businesses specifically affected by our closures. We're going to work with those first. There's other businesses, like I'll use the example of the dentists whom we did not close. They closed voluntarily on their own. They've put a great North Dakota Smart Restart plan together that's going to enable them to get started. If they want to get started before April 30th, they could go ahead and do that because they were never mandatorily closed. Same with any other businesses. The time is now to start working on your new standard operating procedures as we go to that new normal. And again, when we think about what that means, this could include daily disinfection procedures, mandatory health and hygiene protocols for employees. It might mean discontinued use of shared items. I mean, if you're used to going to a restaurant and them handing you a pen that's been used by everybody else, sales of pens might go up because either bring your own pen, BYOP, I guess, on your own pen for signing a check. But again, we want to avoid those shared use items in all environments. So the pen on the counter with the big flower on top of it, so you don't take it home with you, that one may have to go as well. Those will be historical memories of the past. But again, limiting the number of customers into the businesses, requiring masks may be worn by employees and others. should be a strong increase in no-touch faucets, hand dryers, door kicks at places. If those don't exist, creating opportunities for people to use a paper towel so they don't have to grab a handle. Those are all things that people should start thinking about and can start thinking about now. Because if you're planning on your planning for your own reopening, the time is now to start thinking about how you put these in place, because this could be part of the new normal going forward. One of the other things we talked about was the need for widespread testing. There was some good news today related to serological testing, which is the blood-based testing, and particularly the finger prick testing. We've talked about that at previous press briefings. The PCR tests, which are being done today globally to detect COVID-19, it can indicate the presence of viral material during the infection. If you test too early, you might test negative. If you test late, it might test negative. You have to have a viral load to have that PCR test give you a positive right now. If you've had COVID and you took a PCR test next month, it would not be able to tell whether or not you had previously had it. It would tell you whether you had it at that moment, because it's testing the viral load. The serological testing is testing what's in your blood. It can see whether or not you've built up antibodies. So serological testing can tell whether someone has had it and recovered. Abbott Laboratories announced today they're launching a laboratory-based blood test, and they'll ship nearly 1 million tests this week, ramping up to 4 million tests in April. By June and beyond, they're hoping to be shifting 20 million tests in the U.S. alone. So that is on the near future. That's sooner perhaps than some thought, but that's great news. And again, we've said before, this is about restoring and saving lives, and it's also about restoring and saving livelihoods. And it's about the people and the economy, not both. And it's about human well-being. It's about getting reopened. It's not just about dollars and cents. It's about easing isolation and improving mental health. And as we approach April 30th, and we've got teams of people working with these different associations, particularly those who've been affected by the closure orders from the state, those are the associations we'll be reaching out to first and immediately to work with them to come up with agreements and plans on how we can do that. And so we'll have plans that are then developed in conjunction with Commerce and approved by the North Dakota Department of Health. And our plan is to have all of those in place before or by April 30th. And again, with the optimism that we can start potentially reopening on May 1st. But this is our plan. As we've come to learn with the coronavirus, plans can change, and whether we reopen then or not depends on positive trends continuing. It depends on whether people are still observing and practicing the North Dakota SMART guidelines, because that's what's helping keep the number of cases down and helping us avoid a spike in cases. It's also going to be dependent if we're capable of building up our expanded testing and our expanding contact tracing, which I'm confident we will be able to do. One of the things that there's been a lot of questions about is the model, and I want to talk about that next. We know that, as we've said before, models are not destiny, models are an input. And one of the preoccupations is, when is there going to be a peak? And because somehow people maybe find the comfort that if there was a piece of paper that said in 3 weeks we're having a peak with some certainty, then people would be able to give some stability to the extreme disruption of their daily lives. I want to point to all of what were the so-called best models in the country, some of which we've talked about here. Those models have been changing so fast that we've actually instructed our team to do screenshots twice a day of those models because they're changing, and they have. And you say, well, why would the models produce such wild different scenarios? Well, because they're sensitive to assumptions, and a lot of people tell you they're only as good as assumptions that go into them. The first point of us creating models was to make sure that we could model through a set of scenarios where there was high compliance and low spread, or where there was low compliance and high spread, and to make sure that we had enough scale in our healthcare capacity to save lives, because It was, again, that capacity to save lives. The current scenarios give us comfort that we can begin looking towards this graduated reopening after April. As time progressed, we've had more data to put into our model. It gives us slightly improved confidence. I would still say confidence is relatively low, at least from me personally, about the models because of the complexity and the variables. But we do know that the challenges of COVID-19 go way beyond what might people think of traditional modeling because A, we don't know a lot about the virus. And currently there's no consensus about the factors related to the virus. I want to specifically point out that all the different models, because many states have had their own models built with universities, those models have very different what they call the R0, the R0, the rate of infection spread. Some people have it as high as 4, some people have it as low as 2. That is a multiplier which has vastly different consequences for the model. Some models suggest that maybe as many as 80% of the people may end up contracting coronavirus, 80% of the entire population before there's a vaccine. Others might say it's 35 or 40. How much someone who's asymptomatic can spread is still unknown and not proven. There's a lot of, I would say, estimates and guesses that go into this. And so it is and then human behavior, which we've talked about, is how many transmissible moments are there? That's hard to know. It depends on how people comply or don't comply. Another key question that's unresolved in the models is if someone gets coronavirus and they get sick and then they get better, even if they've got antibodies in their blood, can they get reinfected or not? That is still an unknown question. So I could go on and give you dozens more factors of which there's enormous amounts of uncertainty. But what we have done is we've worked with internal models, partnered with the North Dakota University System. We've engaged with a national firm, Ventana Systems, which has got some really terrific people from MIT that I've enjoyed visiting with. We've monitored other models that are done by the private sector, including Sanford and Essentia. We're building models on how to scale their healthcare. That was very helpful when we were building our healthcare plan. We had an in-depth conversation with the state of Vermont because they were a similar size population and they were weeks ahead of us in terms of their curve. And again, the partnership between Sanford, Essentia, Avera, and Ventana, we're trying to share data across those. And then we've observed, again, on the dramatic variations in projections for North Dakota on publicly available models. People that have got backgrounds that have contributed to this include nuclear medical science officers, epidemiologists, computer science, mathematicians, engineers, and others. And what we're doing right now is working hard with these modeling experts to try to drill down into the math of some of what I described as the biological nature, and then there's the non-biological, which is the human behavior in terms of how we interact and how we might pass that disease from each other. We have created a model. I'm going to put a slide up here that gives that I'm not going to walk through every node on this slide, but this is the actual physical representation, not the mathematical representation. But this represents all the factors that we're trying to incorporate in our thinking. And all of these, again, represent potential, you change any one of these potential variables and it could change outcomes. And so I think then you would see the reluctance we would have of trying to give a definitive direction. But I would assure people that from our modeling work, we know we have enough hospital capacity, and that was the key point of the key point of doing the modeling initially. We also, again, know that that using Bureau of Transportation statistics, Unicast cell phone mobility data, we're estimating that North Dakotans have reduced their socially compromising, or where you'd have these transmissible moments, by 60% based on our estimates of physical travel being reduced. So people are adhering to the North Dakota SMART guidelines. They're avoiding groups of 10, and together, again, want to say thank you. We're saving lives. And the success may cause people again to say that none of the restrictions we placed were necessary, but reopening does come with the risk and distinct possibility of surge of cases, and the model will be helpful going forward because you can predict a model in this model, but if you plug into this model and say, hey, we're going to start reopening in a few weeks and we're going to have more transmissible moments, what could that lead to? Well, that could lead to more of an outbreak. Yeah, but what if we've got really good testing and we identify that early and we do great contact tracing? Well, then that would be less. And so there are things that we can do ourselves that we can control, and we want to focus on the things we can control. And we can't control the virus, but we can control building up our testing capacity. We can control how great we do as a state in terms of contact tracing. So those are two things. And then we can again continue to work in teamwork with all of you to make sure that we're following the guidelines to buy us a little more time to get through a steep curve if we're going to have one in the coming weeks, and to get us to the point where we can have plans in place for a North Dakota Smart restart. The next thing I want to talk about is a commerce update related to that North Dakota Smart restart, which is that we know that, again, businesses are particularly hard hit, but we applaud many of them who have either remained open under new operating operations, the innovation, the resiliency they've shown. Others that have closed are doing the hard work of navigating the new federal programs to take care of their team members, their employees, and we applaud them for that and want to continue to help them as they navigate that assistance. But today, we'd like to provide you an update regarding the state's efforts that support businesses in our economic resiliency. And joining us today, calling in, is Michelle Comer, North Dakota's Commerce Commissioner, and she'll provide an update on these topics and possibly more. But here's Michelle. Thank you, Michelle, for being here.
Thank you, Governor Burgum, and good afternoon, North Dakota. Thank you for your time today. As Governor said, I'm Michelle Comer, and I'm the Commissioner of Commerce. In the past 5 weeks, the Commerce Department has dedicated all of our energy to support North Dakota businesses in these trying times. To serve North Dakota, as Governor Burgum said, we immediately led the formation of the Economic Resiliency Team, made up of agency leaders and elected officials from across state government, in order to take a coordinated approach to providing businesses and employers resources that are important in this time. We dedicated a team of researchers to track and interpret federal legislation as it has developed, so businesses are prepared to act as quickly as possible. We launched a one-stop website so that the most current, accurate COVID-19 related resources for businesses can be accessed in one place. These can be found at ndresponse.gov under the Business and Employers button. We acted quickly to make North Dakota businesses aware of these resources, holding our first business briefing on March 17th, even before federal guidance was final and programs were launched. For the past 5 weeks, we have held weekly business briefings in partnership with the Greater North Dakota Chamber to provide real-time updates to the business community. We estimate that more than 6,000 business representatives have been in attendance so far, with one more to go. And today, I'd like to provide an update on the 2 federal resources available to support small businesses, for which the funding is first come, first served. First, the Economic Injury Disaster Loan, or EIDL, a low-interest loan for up to $2 million with up to 30-year term and a $10,000 advance feature. This loan is available through the end of the year or when the money runs out, and it's applied for directly with the SBA at covid19relief.sba.gov. The new information is that since that program was first announced, the advance feature has evolved to mean an up to $10,000 advance, which depends on the business's number of full-time equivalent employees, with $1,000 per FTE available up to $10,000. When the application was first launched by the SBA in mid-March, it did not include the advance feature. This was added later. We have learned that EIDL applicants who applied before the advance was added may need to go back to the portal to complete their application. If you have applied for an EIDL and not received it, please check your loan status in your SBA portal there may be further action required by you. If you have applied for and completed your application but have not heard from the SBA, you may email disastercustomerservice@sba.org to request an update. And I'll repeat that email address one more time, disastercustomerservice@sba.org. The funding under the EIDL was delayed for several weeks after its initial launch in mid-March. However, we are now aware of North Dakota businesses that have received the advance and have been approved for the loan. Because the funding pool was significantly smaller than the PPP, the Paycheck Protection Program, which we'll talk about in a moment, we would expect it to be exhausted sooner, with reports as recent as today indicating that applications have exceeded funds available. Those reports are not yet official. We await data from the SBA to see how many North Dakota businesses have been able to access this funding. Next, the Paycheck Protection Program, or the PPP, a loan with a forgiveness feature that is contingent upon the business keeping employees employed. The loan maximum is approximately 2.5 times monthly payroll, up to a maximum of $10 million with a 1% interest rate and a term of 2 years. This loan is available through June 30th or when the money runs out, and is applied for through your local lender. The update on the PPP is that nationally, nearly $300 billion of the $349 billion available for these loans has been approved. As of Monday evening, North Dakota had issued 8,232 loans totaling more than $1.3 billion. When compared to states of a similar population with a similar number of small businesses, we are outperforming. In other words, North Dakota has received more PPP loan dollars per capita based on the number of small businesses than states of a similar size. I attribute this to the urgency and cooperative spirit with which we acted. From the Commerce Department's quick analysis and announcement of the programs through our business briefings, to the Bank of North Dakota's weekly briefing calls to support North Dakota lenders, to a close partnership with our local SBA representatives, and a huge nod to the financial services community who rallied quickly to be able to make these loans available to their customers. Metaphorically, we are building a plane while we're flying it, and we are not in charge of the flight pattern. Yet we performed in a manner which we can all be proud, but there is still more work to do. Recent guidance provided by the SBA has provided clarity on when PPP loans must be funded within 10 days of approval, and also what documentation is required by those who are self-employed, which we will be discussing in more detail at tomorrow's business briefing, and I will share the details about that call in a moment. While PPP funds remain available, we don't expect that to last much longer given the run rate on the program. Some have speculated that the funding could be exhausted shortly, and unofficial sources have stated that could be as soon as this week. While it's been widely reported that Congress will act to make more money available to fund these programs, we continue to urge North Dakota businesses to consult their tax, accounting, financial service advisors, and lenders to determine if these loans are right for your business, with time being of the essence. As mentioned, we have consolidated COVID-related business resources at ndresponse.gov under the Business Employers button and the Financial section. There you will find more specific information, including recordings and presentations from our prior business briefings. The presentation decks include links to resources to double as a toolkit for your business. Tomorrow, we will hold our final regular weekly business briefing at 11 a.m. to provide new information learned or released since last week's briefing, including specifics regarding the PPP for the self-employed, PPP loan forgiveness, unemployment insurance expansion updates, tax updates, fraud schemes, and we will end with some discussion about what comes next. Going forward, we will schedule business briefings as new information or resources are released. You can register at ndchamber.com, and you need not be a member of GNDC to join us tomorrow. The Commerce Department is also able to respond to specific questions relating to the financial support available to you by emailing the Department of Commerce at businesshelpcovid19@nd.gov. While we cannot provide you financial advice, we are available to help you navigate the resources available to your business. Finally, as Governor Burgum discussed, the Department of Commerce looks forward to the next stage of our new normal, working with businesses and employers to identify new protocols to restart without a rebound, so that we can safely guard the lives of North Dakotans while finding a North Dakota smart path to restoring our livelihoods. Thank you, and I will stay on for questions.
Thank you, Michelle. And one change I want to make it's SBA.gov versus SBA.org for those of you that were taking notes at home. But thanks for that update. Michelle will be available for questions. Still coming up in our program today, we've got a revenue update, behavioral health segment, and some other interesting good news. So stick around if you're still with us. But following this news today about all the things we're doing on the economic resilience, I would also note today's April 15th, often known as Tax Day. It's been Tax Day since 1955 in the United States, where often this is the day that we wrote a check to the government. I understand from talking even to people from around the state, the checks are starting to be deposited today in people's direct deposit accounts as part of the payments of the $1,200 per adult. So it's one teeny bright spot in the new normal is on April 15th. Americans are getting checks versus sending checks. Maybe that's some small consolation, but it would have to be good news, and I'm sure welcomed. The next update is, as promised, is the state revenue update, and I'd call this a bright spot. This may be the last time we get to give a fun, positive state revenues update for a while, but we're facing a lot of big upcoming financial challenges. None of the programs that have been of the $2.2 trillion or more that has come out of the federal government, none of that can be used to replace state revenues. And so the challenging times ahead, but we're happy to know, and I'm sure the legislators that are watching will be happy to hear this, but we just got the report for March today. Sales tax revenue in March was over forecast by $21 million. A lot of this was related to the result of the timing of returns that were processed at the beginning of the month due to February ending on a weekend. Sometimes we get some timing variations, but motor vehicle excise tax exceeded forecast by $1 million in March, and insurance premium taxes were over by $5 million. This is all, I guess, good news. So that gets us 9 months out of 24 into the biennium, and our biennium overage is still $121 million ahead of forecast. So that is good news. And with the extension of income tax filing date to July 15th, we have transferred additional funds to the refund reserve account to ensure tax refunds can continue being paid out. Normally we'd be issuing refunds now as well as receiving. The state would be receiving taxes, but we're going to still be paying out refunds. So if people had a refund on their North Dakota tax return, they've probably submitted it. But now March individual income tax filings would have likely also been positive in this as well, but we'll see that March individual and April income tax won't be coming till July. So good news that we had such a positive March, even with the deferment of tax revenue till later in the summer. But I'm sure when we see April, it'll be a different story. Next up, one of the things that people are battling in certain parts of our state in the spring is not just COVID, but it's also flooding. Flooding is something that many North Dakotans are all too familiar with, and that's why we continue to work at the state level. The legislature's taken strong action in recent years. The State Water Commission in working with the federal government to try to create flood protection for all North Dakotans. We're closely monitoring the flooding situation across the state. We know that there's current flooding challenges in eastern North Dakota, particularly northeast, and Trail County all the way up to the border. And we also know that in Jamestown, there's a lot of people that are northwest of Jamestown along the James River, because of all that moisture we had last fall, are really challenged. We've got Cody Schultz here from our Department of Emergency Services to give an update. Cody, thanks for being here.
Good afternoon. Thank you, Governor. This spring, the COVID-19 crisis is affecting all North Dakotans, and as we work to slow the spread, we are also aware that many of our citizens this spring are also concerned about flooding, as the Governor mentioned. First off, I'd just like to thank our state, local, and tribal partners for incredible communication and cooperation since the historic fall flooding from last year. While we have some real challenges, we are in a much better shape than we thought we might be when we went into freeze up. With record soil saturation throughout much of the state, over the 95th percentile in a majority of our state. So in anticipation of significant spring flooding, the Governor led and the State Water Commission and DES supported the development of a widespread communication campaign for the National Flood Insurance Program. It consisted of television, radio, social media, and print communications that promoted the purchase of flood insurance to help protect our citizens' most expensive investment, their home. And like in the fight against COVID-19, North Dakotans took smart, prudent action to reduce their risks. There was an increase of almost 2,000 policies between November 2019 and March of this year, and that represented an 18% increase. The number of NFIP policies in our state is now over 12,000, representing over $3.5 billion in property coverage. So as spring progresses, we're closely monitoring the flooding situation across the state, and we're aware of the current flooding challenges, primarily in eastern North Dakota, particularly within the Red River Valley, as the Governor mentioned, from Trail County north. We are seeing some transportation infrastructure impacted, adding stress in an already stressful time. Currently, we have some road closures on I-29 south of Drayton, North Dakota 5 from I-29 to the Red River, and North Dakota 54 from I-29 to the Red River. And we're also aware of a fair number of county and township road closures as well. Some good news, the Red River is now falling at Oslo. It is expected to crest, I believe, today in Drayton, and Pembina is expected to crest next Monday. But we are also fortunate that some cool and dry weather will hopefully limit the impacts and future crests. As I mentioned, cities and counties have been proactive in preparation. The city of Drayton and Pembina have implemented some temporary protective measures in anticipation of the forecasted crests. In the James River Valley, the Corps of Engineers has increased reservoir releases at both the Jamestown and Pipestem reservoirs, evacuating spring snowmelt runoff, which is also reducing riverine flood risks in the James River Valley. Really, widespread overland flooding and damages to our transportation infrastructure continue to be our biggest concern. DES has been in continual communication with our local and tribal emergency managers, and we'll be working with them in the very near future to assess damages as water recedes in some of the overland flooded areas. We'll be partnering with this team of local leaders starting April 20th to determine if the state may be eligible to request federal assistance through FEMA and presidential disaster declarations. We're absolutely grateful for all of the assistance and partnership from our federal partners, but we do have one challenge right now with FEMA and one of their disaster recovery programs as it relates to funding certain road repairs like grade raises on road infrastructure that's underwater. We are working with our entire team at the Governor's office and our congressional delegation to rectify the situation, because it's incredibly important for our infrastructure in our transportation infrastructure in North Dakota. We really believe that this is a mitigation effort, that building roads higher and eliminating year after year damage saves money in the long run, and we're going to continue to push for North Dakota smart solutions to our challenges. Finally, I just want to say to the citizens experiencing flooding during this already stressful time, please know that we're thinking of you, and we are continuing to work with our local and tribal partners. Please reach out to us if there are issues. I think smart mitigation, preparedness early is helping this response. Thank you.
Thanks, Cody. Thanks for you and your team, and thanks for all the local entities that are working to get through this flood season, and thanks for sticking around for questions. On behavioral health update, we know that the pandemic can be a significant stress on our lives, and we've got to protect our families and friends as we are working through this time of physical distance from them. We are very worried about high-risk people. We've talked about this before. We know that some people entered into this at more risk than others, and we need to make sure that we're thinking about them. So if you know someone who's been struggling emotionally or having a hard time, you could be the difference between getting them the help they need. And particularly as it relates to suicide, because there's no single cause for suicide. It most often occurs when stressors and health issues converge to create an experience of hopelessness or despair. And risk factors or conditions or characteristics that increase the chance a person may try to take their life include stress life events, whether it's rejection, divorce, financial crisis, life transitions, loss of a job, pressures, financial crises like businesses closures. I mean, so all of these things could be happening right now and really coming down on people. As we've described before, April is, for many states, including North Dakota, unfortunately the highest suicide month of the year. And if you've got other complicating conditions like depression or anxiety or substance abuse, especially when those are unaddressed, those also increase the risk for suicide. People that are feeling emotional distress can take actions to support themselves and others. One maybe a good recommendation is setting a limit on social media consumption or national news or cable channel news, because often that's designed to increase people's excitement or even increase their outrage, and maybe not good for if you're feeling emotional distress. Staying active. This is, get out of the chair, get off the couch. I know we're saying when we've talked about people staying at home for work and staying at home for non-essential travel, but there are no limits on walking. And I know the weather's been a little cool this last week in parts of North Dakota, but if the sun is melting that ice and you've got a safe surface to walk on, grab some of your clothes and get out, winter clothes, and get out for a walk. I always love citing the Martin Schersen, the Norwegian carpenter in Arthur that I had a chance to work for one summer, who said there's no such thing as bad weather, just bad clothing. And so again, dress and get out there and enjoy that fresh air in North Dakota. It helps your physical health and your mental health. Stay hydrated, avoid excessive amounts of caffeine or alcohol, eat healthy foods when possible, connect with loved ones and others who may be experiencing stress related to this. Talk about your feelings. Enjoy conversation unrelated to coronavirus. Yes, there still are other things to talk about, and maybe we don't have sports to talk about, but you can talk about your favorite victories. Don't think about the Vikings losing 4 Super Bowls because that happened to some of us when we were in our youth. That's probably not good for your mental health. Getting accurate health information from reputable sources. Whether it's our own ndresponse.gov, the North Dakota Health site, or the cdc.gov, those are places where you are reliable sources as opposed to getting information off the internet that may be adding to your stress. And again, if you're experiencing emotional distress related to any topic, the National Suicide Prevention line at 1-800-273-8255. That's also up here on the slide. But again, you can talk confidentially to someone. Call them. If you've called them before, call them again. They'll be happy to talk to you. For coping tools and resources, visit the Behavioral Health Division website at behavioralhealth.nd.gov/prevention/suicide. And again, if you're not having these feelings, but you know someone that might, again, urge you to go to behavioralhealth.nd.gov because your actions, your knowledge of talking to someone who's in distress could save a life. So thank you for that. Quick CARE-19 update. As of noon today, 18,000 participants signing up for the app. I've had an opportunity today to receive a call from the Vice President of the United States asking about how things are going in North Dakota. One of the things we talked about was our efforts to ramp up the technology behind contact tracing, including the Care19 app, and our efforts to build a database to help be able to make sure that we can do targeted isolation versus the broad base, everybody stay at home isolation. And again, talking to the developers, Tim Brookings, they're working on Android, which they're targeting by the end of this week. He reminded me that in software terms, that might mean 11:59 on Sunday night, apparently, is Sunday. Some people think is part of the next week, but so anyway, it'll be coming this week on that Android release, but you can find Care19 on the App Store. And just even prior to this, Governor of Arizona reached out wanting to learn about this as well. Next topic, unemployment claims. We had Tuesday, a little lower day, high compared to history, but low compared to our surge. 1,349 regular claims, 411 pandemic unemployment assistance claims, and 538 pandemic emergency unemployment claims. But that brings our total claims since March 16th on regular claims to 51,065, so breaking the 50K mark on regular claims. And on the new programs that both started on April 4th, the pandemic unemployment insurance at 5,821, and then the pandemic unemployment emergency unemployment, 5,964. Today, the North Dakota Job Service began making payments today for the FPUC payments. Any claimant who is certified eligibility for payment yesterday was paid their normal unemployment insurance, and yesterday they were paid that, and then today that extra 600 additional payment began going out. This amounted almost to $1 million going out today in these additional $600 payments that are part of that federal relief. So again, tonight Job Service will be running a program to release back payments for the weeks beginning March 29th all the way up to the present to catch up for those claimants who did not get paid the $600. Those payments will be going out tomorrow, so more dollars coming out. In closing, before we go to Q&A on the good news section, we know that throughout this time, businesses and organizations were searching for PPE to protect themselves and their team members from the spread of COVID-19, and many manufacturers are stepping up to fulfill that need. One of those manufacturers, of course, is our very own Rough Rider Industries, which is a fully self-funded state agency within the Department of Corrections and Rehabilitation. And Rough Rider Industries employs the residents that are within our system into positions that cultivate skill sets that can be used upon release. It helps them generate wages, teaches valuable life lessons as they prepare to re-enter our community and our workforce. And today they're helping to support our essential workers as they manufacture needed PPE. Last week, Rough Rider began manufacturing utility gowns and face masks for first responders, long-term care facilities, schools, hospitals, and government entities. And the team at Rough Riders is also working to manufacture 2 varieties of masks, and they're making approximately 2,000 masks a day. So I want to thank the team at Rough Rider Industries and all the organizations and individuals that are pitching in to slow the spread. We're in it together. But we also know that, so thank you, Rough Rider, and thanks for the great job our Department of Corrections has done in keeping all of the residents and staff safe at the Department of Corrections. But we also know that a lot of people have taken this up as projects at home, and they're sewing masks for healthcare workers, first responders, and others on a local level. And I wanted to share some of the great work that we know is going around the state. Leanne Hall from Berthold, North Dakota, sent me an example of her work, which I wanted to make sure everybody saw, which is the new bison mask, which is, everybody should make sure you get one of these to have. And I know Brent Sanford is hard at work trying to find a seamstress to create a UND mask for Brent as we head into the fall season. So with that, that concludes our record length in material today, but a lot of important stuff to cover here on what was tax day. And now we'll open for questions.
Does every county or hospital in the state have testing capabilities?
I believe the answer to that question is yes. You're using the word every, so I'd want to confirm that. But there is the ability to collect tests across the state, and of course they're sent to either the state lab If Sanford's collecting them, they were going to their lab in Sioux Falls. If Altru collected them during our partnership with Mayo, some of the Altru were going to Mayo. So we had 3 labs processing collection going from across the state. We'll go with Jeremy and then Jacob and then Tom.
The LM wind power facility, the cases there. It was noted during a press conference today with the city of Grand Forks that the state doesn't currently have the testing capacity or supplies to do sort of mass testing on a large workplace like that. LM has, I believe, 900 workers. You mentioned that as part of the Smart Restart plan. What's the timeline on being able to do that kind of mass testing?
Well, again, I described today 2 different kinds of testing. One is the PCR testing, which we do today, which will continue to scale up. And then the other is the really large scale is the serological or blood testing. Given that we don't have the capacity to run in and test 900 people in this one single plant, the plan that's been designed working with our epidemiologists and local public health is to identify, we know there's 8 positives. And so then we go through the contact tracing and identify all the people that had close contact with the people that were positives, whether they work in the plant or whether they were members of the community or family members at home. And we're going to go and do testing for all of 100% of those people that had close contact. Then we'll take a sample of the remaining, say if that tests 100 or 200 of the 900, the remaining 700, we do a randomized test of the remaining 700 to see if we came up with any more positives. And again, you'd repeat, if you come up with a positive, you identify the close contacts that they were with and keep going. So this is a way that we can try to narrow it down, but again, saving testing capacity, because again, at any point in time, if there was someone in that plant who was symptomatic or had concerns, they could go to their provider and get a test. We have enough people to do that. So what I'm saying, when we don't have enough, I'm talking about people that have no symptoms, or they have no symptoms or no belief that they may have been in contact. I mean, I've toured this plant. It's a big plant. You may have been nowhere near close to the 8 people that tested positive. So again, as we develop that plan, we launch that plan, we'll conduct that on Thursday and then go from there if we have to. Ideally, down the road, if you had the serological testing, you could test everybody before they went into the plant on Monday morning. I mean, that could be part of what happens, and then you would have that kind of widespread capability, but we're a long ways away from that. Jacob and then Tom.
Governor, in reference to the Smart Restart, you've said that plans can obviously change. What kind of ballpark thresholds are you looking for that could possibly lead those plans to change? And if you could gauge your level of optimism for the May 1st reopening.
Well, I'm very optimistic that we, on a number of things. I'm optimistic that over the next 10 days, we're going to be able to continue to make significant progress on testing with the PCR testing, and we're going to be able to make significant progress on contact tracing. And those are 2 things that we have to have in place. Like I said, what we've done it up in Montreal County, what we're doing in Grand Forks County, with the response to a potential outbreak. If we can prove that we can take a 8-person outbreak in one facility and keep it small, as opposed to have it become a 500-person outbreak that spreads into the community, if we can demonstrate that, my confidence goes up that we've got the tools in our toolkit to start opening up. Because when we start opening up, we will risk to have more hotspots pop up. With more transmissionable contact, we'll have more hotspots. So then we need to be able to respond to those and have the capacity. The other thing is also just the numbers that we're going to look at closely in the coming days to see if we're actually in a spot where our curve is starting to head up. Like I said, we were weeks and weeks and weeks at that 3% rate. And if you look at almost all other states other than Alaska and Hawaii who've got unique ability to distance themselves from everybody else, we were doing just fantastic. But that's again, it was inevitable there was going to be a curve some point in time, and maybe our curve was coming a little bit later. We'll see.
But you do believe that a first curve is still anticipated?
Likely that our biggest days of cases are still ahead of us, not behind us. Tom, and then Elaine, and then online.
Governor, my question has to do about testing. Near the 1st of April, a 30-year-old from Williston who lives in Minot got sick. On the 3rd of April, he wrote a text to his friend that said, I called Monday to get tested, but they said they couldn't test me until my symptoms worsened. The burning in my lungs and chest is unlike anything I have felt before. That was on April 3rd. On April 6th, they found him dead in his apartment alone. Question, can you guarantee the families in Williston and Minot that this won't happen again?
Well, the answer is no, I can't guarantee that. But what I can tell you is that I understand there's been an autopsy done afterwards and the test was negative. But separately to whether or not there was a testing was denied on April 3rd, that's like a century ago. That was 12 days ago in this thing. And we've got testing capabilities now that anybody that prevents with symptoms should be getting tested by any medical provider in the state. And so if today someone says, I've got severe symptoms and I wasn't able to get a test, please contact us through all the varieties of hotlines and websites and whatever we have. I mean, call the North Dakota Department of Health hotline, call them and say, hey, I got declined for a test, and we'll figure out a way to get people tested if they've got those kinds of symptoms, because we do have that capacity.
There is some question as to whether post-mortem tests are accurate. Do you share any concern there?
I don't have concern on that because I've got full confidence in our state lab's ability to conduct autopsies. Lane?
My question is actually for Michelle.
Okay, fantastic. Michelle, are you still with us?
Yes, I'm here.
Okay, fire away, Lane.
Okay. In reference to idle, we've had several small businesses here in town calling us saying that they've had problems getting those benefits. One of them even told us that they've only received $1,000, and that was the most that they were told that they were going to get. Is the fact that idle was first sold as being handing out $10,000 to small businesses, giving some of these businesses false hope?
I'm not really sure how to answer that question. As I mentioned earlier, the guidance did evolve from the time the program was launched in mid-March until today. But I'd like to believe that it's not given false hope. We are aware of a number of businesses in North Dakota that have both received the advance and been approved for the loan. It remains to be seen how widespread that is. Just for perspective, I want to make sure everybody understands that the pie for the PPP is $349 billion, and the pie for the idle is $10 billion. So it's a much smaller pie, and I would expect that we would see, in terms of North Dakota businesses receiving those loans, sort of a proportionate result. But again, I reserve comment on whether it's false hope, and I do hope that we will see, when it's all said and done, that North Dakota businesses did benefit from the idle. I believe that we were able to act as quickly as any other state when the program opened and we became aware of it.
Thank you, Michelle. And Lane and others and all the media watching online, I would just encourage anybody, if you get a report like this, to make sure that they contact the Department of Commerce, because we are as interested as they are. If they somehow applied for a federal program and it didn't deliver the way we thought the feds were positioning that, we want to know that too, because we can provide that back to our federal partners and would want to work with them. The whole point of what the Commerce team is doing is try to make sure that people that qualify can get all the funds that they're eligible for under these new programs. So again, if you've got that, I know that Michelle and her team would be happy to take the contact information for that individual. Dave, or no, we're going online and then Dave.
Scott Hennon with WZFG KFYR Radio. You suggested businesses not covered by the executive orders were free to reopen now. What is required for them to do that? And is it your goal to have the businesses and schools covered under your current orders could be open by May 1 as long as they follow the same guidelines?
I think there were multiple questions in there from Scott, but if there were businesses that weren't covered by our order and they are not open today, then they voluntarily closed, and they can choose based on their own business models and their own precautions for themselves and their employees to open again, because there's no restrictions on people that voluntarily close, and that goes from the dentists that are working through their association to anybody else. So again, we're focused on the people that we did specifically mandate to close and helping to get them to reopen. We didn't talk about schools today. And that's a different topic. We are really pleased with what we're hearing from parents and school teachers and superintendents about how distance learning is going. And that could be a topic for a different day about schools and where they may go. But right now, schools are on a great path right now with the distance learning. And we certainly don't see any change in any recommendations relative to schools through April. Dave?
Just to follow up on that, in terms of the businesses that you mandated to close, if they come up with plans and if you develop plans through the team about their guidelines for reopening, are the guidelines going to have some teeth in them? Some perhaps sanctions against people who may, cheat on the guidelines or something like that?
Well, this is one of the things that the economic resiliency team and the whole North Dakota Smart Restart teams that are working industry by industry are going to have to take a look at, because as soon as we say people need to operate under new standard operating procedures, the minute we do that, that's when all of you and all of us will start hearing about someone who's not following the rules. So the enforcement component of that is something that we're going to have to take a look at. Again, we hope that in all these cases, like it was here, whether it was the voluntary work that people did to follow guidelines or the mandatory ones, in all cases, we were fortunate in North Dakota, we had very, very high compliance. And again, I credit that back to people. I'm sure that we'll always find some that are not following the rules, but we'll be confident that going forward that people will understand what we're trying to do, the why behind what we're doing, and the why is about saving lives and saving livelihoods. And to do that, because a business reopens, they don't follow the guidelines, they have a big crowd, they have an outbreak. We've got the ability with the health department to shut them down. And that's not going to be good for their employees or